So I have a very exciting video for you. We're going to look at a hair transplant result that I came across 2 weeks ago. I have all the pictures, but I know nothing else about the guy. I don't know where he's been. I don't know how many grafts he's had. I just have the pictures. So we're going to do an in-depth analysis of the pictures, and we're going to basically ask the simple question: has his hair transplant been a success or failure? Keep watching. So this video will teach you how to analyze a hair transplant result when you are researching for a hair transplant for yourself. If you don't know what a good hair transplant looks like, you are heading for a failure yourself. So let's start by looking at the before pictures, how he looked before he had the hair transplant. So the first thing we need to talk about with this client is that his hair loss is active and progressing. So in the corners, there's severe hair loss here, in these two corners. But you can see the middle, it's got this kind of island of hair. This is eventually obviously going to thin out. So the challenge is, what do you do with this bit here? Do you still operate on it, or do you just leave it and just concentrate on the corners? So that was the first challenge. The other thing we can see is that his donor hair, we can't fully see it, but it seems his donor hair is fairly good. The hair is quite long on the sides. And the other thing that we can comment on is the placement of the hairline. So I think the placement is quite good. It's not too low. If it was somewhere kind of here, it would have looked really cheesy. So I like the placement, and I also like the shape that they've designed. The shape is not too straight. It kind of got an angle, so it comes down like this and then it goes in. So it's not like a straight line across here, which again would have looked really fake. So very good. That picture gave us a good idea about what's going on at the front, at the hairline, but that's not enough. We need to see what's going on at the top, at the crown, at the sides, at the back. So it's still a long way to go. Let's have a look at a picture from a different angle. So this picture is just before the procedure, and this picture is from above, so it gives us more clues about what's going on. The first thing is that, yes, the corners are severely receded. I mean, his corners were maybe along here when he had a full head of hair, and now they're back all the way here. So they probably receded a good couple of inches. And here we can see this is the island of hair that we talked about in the first picture. And something else you can see is the crown is definitely thin. So the team have marked out the crown, and as you can see, the crown, if you compare it to this area here that has healthy hair, this area is quite dark, and this area, look how shiny this is compared to this. So there's definitely some thinning on the crown. And there's something else. If you look very carefully along here and compare it to these areas here, you can see that this strip here along here is a lot thinner than this side and this side. So that tells you that his hair loss is tracking, it's progressing along here, and eventually in a few years time the crown and this area here are going to be connected, and you're going to have full hair loss along here. So even if you operate on this area here and this area here and on the crown, what do you do about this? Because the hair loss is progressing here. That's another challenge. So when I'm doing consultations for hair transplant clients, this is exactly why I ask for so many pictures from so many angles, because each new picture gives you so much more information, new information. Now let's have a look at a picture immediately after the procedure so that we can see what the clinic has done in terms of all the challenges that we discussed. Let's have a look. So this picture I think is immediately after the procedure, maybe a day or two, I don't know. And this area here gives us a clue about what happened in the procedure itself. So the first thing is they obviously fixed the corners, so they've transplanted hair in the corners, so his hairline is now looking a lot more like it did when he had a full head of hair, which is good. And they've also gone for the island, the little island at the front of his head. They went for it and transplanted some hair, and they also transplanted some hair on the crown. Now I personally think that if this guy doesn't use medications like Regain and those type of medications, he's eventually going to need a second procedure, because as I said before, this area is still thinning. So this area is a concern, so is this area here. So if he doesn't use anything, he might need further procedures in these areas here. It always amazes me how good a hair transplant looks in the first day or two after the procedure, when the outlines is sharp. For some reason, all that redness on the scalp really gives the hairline a nice shape. I don't know, maybe it's just me, I don't know. Now let's have a look at the same client when his hair has actually grown. And voila! So this is the same client, must be 9 months, maybe 12 months after the procedure. He's had good hair growth, and this is pretty much the final result. So what can we see in this final result? The first thing I'm going to say is the thickness is amazing. So the hair is thick. I'm not sure if he brushed it forward, which even gives it even more thickness, but the thickness and density is excellent. The hairline is quite appropriate for his age in terms of how high the hairline is. So this guy is in his kind of 40s maybe. So if he had a really low hairline along here, it would have looked really cheesy. So that's good. For some reason, the shape of the hairline looks a lot more straight in this picture than the previous picture. Why is that? Is it because he brushed it forward? I think it might be because he brushed it forward. And if he has, maybe he's better off brushing it backwards just to give it a more natural look, because I think with this look, the biggest downside is it just looks like a wig. It just looks like somebody took a toupee and just placed it, plonked it on his head. And that is not a good look. Now, I really hope the reason for this is because the way he styled his hair and the fact that he brushed it forward. But if this is not the case and this is how his final hairline is, whether he brushed it backwards or forwards, then it's a big problem, because A, it's too straight. The placement is fine, but it's just too straight for his age, and it's too thick. We're not seeing kind of gradual build-up of thickness as you would want to see in a natural hairline. So that's another big issue with this. So now for my verdict, has this hair transplant been a success? I think absolutely it has been a success, because from where he started, he's got amazing density. He obviously had good donor hair, which helped. The placement of the hairline is reasonable for his age. The only issue for me is afterwards how straight the hairline looked. Now I'm hoping that's because of how he brushed his hair. So for this client, I would say do not brush your hair forward. It's just going to end up looking like a wig. What I would say is brush it backwards, maybe use some gel or some wax just to break up that thickness at the front and give it a more natural look. Definitely you'd rather have hairline that is too thick than too thin. So overall, a success. What do you think? Do you agree with me? Has it been a success, or you don't really like it? Let me know in the comments below, and I'll see you next time. Take care.